Hi everyone, Dr. Remy from Pain Free and Fit and Posturcise. A lot of you have been writing into the channel asking how do I determine what my neutral spine position is for my lower back exercises. Today's video is going to answer just that. Hope you enjoy. So a neutral spine is a position where the spine is held in an area that doesn't aggravate pain or stress mechanically the soft tissues in the area. And it has to be determined by more than just one motion. A lot of people think neutral spine position has to do only with, in the lower back, anterior and posterior pelvic tilting. And while that's correct, there's a lot more to it. Tilting your tailbone under to the point where you feel a little discomfort or pulling in your back and marking that as one extreme, and then raising it up until the arch in your back increases to the point where you feel some discomfort in your back. That's another extreme. A neutral spine position for this particular motion is placing your tailbone or your pelvic tilt midway between those two extremes. That way you have a lot of area to move to in either way before you're stressing the soft tissues that give you pain. It's the mid position between those extremes of motion that's going to avoid aggravating soft tissues and pain. But we also have a lateral tilting direction of movement, which is leaning our rib cage down on one side or another, or raising our hip up on one side or another. That's called hip hiking, when the hip swings up. And it's very commonly due to a condition where we have an external or forward rotated leg that creates hip hiking on that side. So one of the things you can do is, in a neutral position, is to swing your hips back and forth and see which direction causes some pain. And at that position from neutral, you want to mark that edge where you first begin to feel a little discomfort, and you also want to try leaning your rib cage to one side or another. And if you have a certain point where it starts to become discomforting, you're going to mark that. And then you're going to place your spine halfway in between those extremes of motion from the neutral position, so you stay away from that motion of pain. Similarly, rotation, which is a twisting. The pelvis twists from one side to the other. The chest or torso twists one side to another. If you have a tendency, let's say, to have an abnormal posture where as you're moving, squatting, lunging, to have your hips, let's say, in a simple position as a squat or a lunge when you come down, if your pubic bone twists away, and that creates low back pain, whether due to lumbar, sacroiliac problems, you'll find that many times positioning to neutral your spine, creating a forward-facing pubic bone, will help to relieve that pain. So along the same idea, you can test out rotating your hips from right to left with the knees slightly bent and see if one position has a certain degree of tension or pain in the back, and then going the other way and see if another position has the same tension or slight irritation. You want to position your pelvis halfway between those two. If your rib cage turning to one side or another creates the same problem, again, you're going to position it halfway in between those two extremes. Many times your position halfway through those extremes is going to set a postural correction, whereas if you typically have your hips going to one side or your rib cage going to one side, learning the midpoint position will oftentimes cause you, that midpoint position, to bring yourselves more towards a normal alignment, whether it be in rotation, whether it be hip hiking, torso side leaning, or anterior posterior pelvic tilting. Once you combine those three, in other words, the midpoint position of pelvic tilting, as you hold that, the midpoint position of one hip down, one hip up, midpoint position of tilting side to side and rotation, that is your three cardinal direction neutral spine to avoid moving into pain. You're in a center of position that's safer on your spine than those other directions. You can add to that some translation postures, which, if you have sway back posture where your hips are more forward than your rib cage or your head is more forward, try bringing your hips back, your head back, and your rib cage forward to a point that alleviates your lower back pain. Many times if you bring your hips back too far, you'll feel your back. Forward too much, you'll feel your back. Positioning it right in the midpoint between those two extremes, again, will be a neutral spine position. You can do the same thing with the head. The head pulls on fascia, different muscles and fascia and ligamentous tissue that runs from your neck and head all the way down your lower back. That can affect it as well. And as well, you have a translatory lateral translation posture. Many people will not have the pubic bone, belly button, center of the chest all lined up, but they'll have a slight posture or tendency to sit or stand or move to one side. So again, moving that back and forth, finding the mid position of either the torso, the hips, or even the head can change the mechanical pressure on the lower back. You want to then combine that along with an axial, which is an up and down translation. The more you lengthen yourself, you're going to stretch spinal joints, ligaments, muscles, tendons, and disc fibers. And the more you let your spine compress, you'll feel pain also. Many times in degenerative conditions like degenerative discs, herniated discs, an axial elongation will help to alleviate some of the pain, but too far up will actually irritate. As likely, a seated or standing compression will irritate that pain. You want to put yourself halfway between that. So between combining these 6 vectors of motion, both anterior and posterior, tilting, finding a midpoint, hip hiking or sideways motion with the hips or leaning with the ribs, as well as turning the torso and the pelvis, and translation of front to back with the hips and the head, and side translation with hips, torso, and head, as well as vertical compression and decompression. Combining all 6 of those, you're going to be able to set your body in a position that holds your neutral spine. And then you're just going to maintain the proper muscular tensions that help hold that. That's outside the scope of this video. That's learning how your multifidus works, how your abdominals work, internal, external oblique, rectus abdominis, how your back muscles like longissimus, iliocostalis, latissimus work, quadratus lumborum, and how to set those correctly to then hold that position with muscular tension so that when you begin your healing exercise program, whether it be planks, bird dogs, squats, lunges, stir the pots, whatever exercise you're doing, you know how to engage that neutral spine, that exact position, and maintain it as your limbs, like your hips, work, as your upper back twists and bends, as your upper extremities work. That spine in your lower back is stable. Force is allowed to transmit through it from upper to lower extremity, but you're not actually moving it out of its neutral spine position. Or if you are, you're just moving a little bit as the spine moves past that midpoint or that safe neutral spine position. If you like this video and would like more on lower back healing exercises, feel free to subscribe to our channel. We get a lot of great videos out there. If you'd like to help me share this vital information with others, give me a thumbs up below if you like what we're teaching. If you have any questions or comments, write in. I'll do my best to answer them. If you're looking for a personalized exercise program to help with your lower back pain, go to our painfreeandfit.com website. We've got great fast-track programs for spondylolisthesis, Facet syndrome, degenerative disc disease, all teaching you these analysis and all the exercises that follow along with it to strengthen your body and prevent pain, as well as get you back into the activities you like while providing a healing stimulus to your lower back. If you'd like a one-on-one consultation, contact me through the website, painfreeandfit.com. We can get together a number of ways where we can discuss your unique case. I can take a look at your posture and mechanics through video conferencing or other measures, and we can get you headed into a tailored specific exercise program to help with your lower back pain. I hope this sheds some light on the often confusing and misunderstood concepts of neutral spine and RPI and helps you with your chronic lower back pain.